Sure. My name is Dr. Carl Giordano. I am a board-certified, fellowship-trained orthopedic spine surgeon. Both my partner and I perform all of our surgeries at a spine center of excellence. My partner, Dr. Knockwalter, and I discuss all of our cases all the time. Together we challenge each other to stay current on all indications and techniques. Both of us are fellowship-trained and have tremendous experience, having performed together over 10,000 operations. The field of orthopedics and neurosurgery is extremely specialized today. After one completes a residency in orthopedics or in neurosurgery, you have to spend an additional year in fellowship where 100% of your time and training is dedicated to spine surgery. Surgical techniques for treating spinal conditions have come a long way. Blood loss is minimal today. The risk to the nerves are minimal. Infection rates are close to zero. A lot of patients go home the same day with regards to the smaller operations, such as a lumbar microdiscectomy or a neck operation called a decompression and fusion of the neck. Some of the larger lumbar fusion operations typically go home within 48 hours. Spinal surgery innovation has come a long way. Surgeons and industry continue to work together to innovate better implants and techniques. Pretty much every spine operation has some minimally invasive component to their spine surgery. I myself have worked in the past with DePuy Johnson & Johnson to develop a band clamp that connects screws to the rod. It's a smaller, less bulky connector, but a very rigid connection. I'm also working on a new device to treat a stress fracture in the lower back called a spondylolysis, or a pars fracture, that exists in up to 6% of the population. I was recently awarded 4 U.S. patents for that device, and I'm hoping to bring that plate to market in the near future. Experience counts in spine surgery. It really does count. I have about 25 years of experience, and that degree of experience is invaluable to fine-tune my risk assessment and my understanding of my own technical ability. It also provides invaluable experience in conveying outcomes and expectations to patients, which are all key in obtaining the highest patient satisfaction possible. I enjoy what I do. I really do enjoy it. I continue to lecture around the country regarding what I believe are best practice guidelines. I have a number of publications in peer-reviewed journals. I've recently authored a non-fiction work titled Shoot the Moon, a look behind the curtain of medical school and residency. I'm hoping this book gets into the hands of high school and college kids to give them an idea of what it's like to go to medical school and residency, and hopefully motivate them to pursue orthopedics as a career. It's a very realistic look at orthopedics as a profession, as well as the making of an orthopedic surgeon. The book, not only is it about the journey of going through medical school and residency, it also highlights a terrible episode in my life where I was actually in an airplane crash. I attribute that calmness and that lack of panic to something I experienced every day in the operating room for the last 20 years. I think the adult population needs to know that if properly indicated, spine surgery can be extremely successful and significantly improve quality of life. And I know everybody knows somebody that had some spine surgery and did poorly, but I can guarantee you that if you look at those cases closely, with the poor outcomes, the majority of them resulted in a failure of indication or a failure of technique.
I broke my back 3 times. He did the surgery, and it was probably the best move I've made one of the best moves in my life I've made, you know. The pain went away instantly. I remember when I woke up, the same pain that went down my legs wasn't there. You know what I mean? The first time in a long time. And it really went outrageous. It was everything he said it would be and more. And, you know, I was back to work in no time at all. I mean, it really went well. One of the things that probably got me the most is when I went back to work, it was a week after the surgery, and I could do, you know, there were things, you were still sore and hard to move and all, but I could do a lot. I went about my day and carried it out how I had to. And he did a great job, can't say enough.
I was having like this nagging ankle pain and calf pain, and I thought, oh, I must have just done something. And as the months progressed, I literally could not walk without pain. And they found that I had a big herniated disc. This is unbelievable. I mean, I can't even believe I drove here. I live 20 minutes away. I got into my car and I said, I'm driving. And I drove and it was fine. And it's It's amazing.